For some people, that can start very instantaneously. Some people know exactly when it happened. I was lifting a heavy box and twisting and turning and putting it in the back of my pickup truck, and I felt something pop in my back, and since that time I've had back pain and pain going down my leg. That's a fairly common type of presentation for a patient. For others, though, sometimes it's just, man, I've had this back pain for a long time and it's getting worse. I used to be able to treat it with my chiropractor or physical therapy or a massage, but that's not working anymore, and now it's starting to go down my leg, and it's just getting a lot worse. I'm not sleeping well because of this pain, and I can't go to work. I've missed work because of this pain, and I need something done with it. And so those are the two scenarios that can happen and start very abruptly or just come on very slowly as well. I think trying to, just generalize low back pain, doing the best we can to try and manage that with maybe some simple ice and heat at home. If you're able to take some Tylenol or maybe some Advil or ibuprofen, try those things. When it gets to the point where, I'm missing work, I'm not sleeping well, this is affecting my everyday activities, I'm not able to spend time with my children, I'm not able to go out and be with friends and do the things that I enjoy doing, that's when this pain is really affecting your life and the normal activities of your life. And so that's the time to seek some treatment. Or for sure, if you get weakness in a leg and that leg's not working, or an arm, those are times when definitely you need to come in and be seen, because that can be quite serious and something that needs to be addressed quickly. It's often that a patient will get at least an x-ray, if not sometimes an MRI, especially if that pain is spinal generated. If it's coming from the spine, an MRI is definitely something that we're going to need. But if it's not, there are things that we will definitely work through first. Again, implementing some physical therapy, some modalities that way, before we progress to an MRI or even an x-ray. Or if it's more myofascial pain or what we call muscular pain, then sometimes we don't need that imaging and we can just treat that without. Usually, again, a kind of a varied approach, or what I like to call a multimodal approach to treating pain, gives a person the best results. So often we will definitely incorporate some physical therapy. That can absolutely be very effective and beneficial. We combine that often with some sort of steroid injection that we might do. That might be an epidural steroid injection. It might be an injection into the little muscles around the spine, or somewhere else in the body, wherever that pain is coming from. It could be injections into the joints. Sometimes we'll encourage chiropractic care. That can be beneficial. There's sometimes some nutritional reasons that we'll talk about that might be causing pain, or some things that we can do to help reduce pain from a nutrition standpoint as well. So really, there's a multitude of treatment options. It's very, very much so individualistic as far as the patient and what's going on in their life, and what therapies and treatments they're able to get to, what works into their schedule, and that sort of thing. So we try to tailor that to what works for each individual patient.